difficult sitting for long periods of time or standing for long periods of time, especially at the end of the day where you feel some leg pain and even fatigue, you could be suffering from varicose veins and not even know it. We're here at Medical Vein Clinic where they have the answers for you, and Dr. John Hogg, president and physician, joins me. The quality of care here is what sets you guys apart, and you notice it the moment you walk through the door.
Thank you. Well, that's what we want. You know, our patients, we treat them like family, and we wanted, first of all, to come up easy access, easy to get in, but I kept seeing patients. They ended up being, it was my mother-in-law, it was my other half, it was people working in my office, you know, that share and say, Dr. Hogg, I have something I want to share with you. Do you mind if I ask you a personal question? They'd show me an ulcer on their leg. And they'd say, I think it's from this big varicose vein, but they're all around us, and people suffer from this. It's one of the things that creeps up on you slowly. I think that, you know, if you have a cold or you go to the doctor right away or you're in an accident, but something that is gradual over years, you often ignore and you think you're just getting old and your legs are tired at the end of the day. You can't wait to get home and prop up your feet. Can't cook supper anymore because you can't stand at the end of the day. Those are the people we want to help, and we can treat those and get them back to a better quality of life.
Dr. Josue Medina joins me, and tell folks, what are some signs and symptoms of vein problems?
Signs and symptoms, they can range from real mild symptoms to severe symptoms. Initially, most patients will see maybe some varicose veins starting to come out on their legs. Some patients will have aching, pain, burning, tingling sensations. They might even notice color changes as the symptoms get worse and signs do. They might even have ulceration, which is what we want to try to avoid.
What are some risk factors for varicose veins?
Some of the more common ones are hereditary. If your parents have varicose veins, you're more likely to have them. Other things is lifestyle, prolonged sitting, prolonged standing. Other things is gender. Females tend to have this more than men.
So for someone who has varicose veins, let's talk about treatment.
So initially, if you see varicose veins and you're starting to notice some of these symptoms, what we do here at Medical Vein Clinic is we first do a physical exam from head to toe and put everything as a whole with the patient, not just veins. Once we figure out they do have what looks like venous insufficiency, we'll order an ultrasound where we do look at the veins and look at the deep system, look at the superficial veins, and look for problem with the valves and the direction of blood flow in the veins.
So what can be done to prevent it for someone who sits all day or stands a lot?
Well, one thing you can do is if you're at a desk job and you're just constantly sitting all day, you can, do calf raises. What I tell patients to do is kind of pump your calves like this. Another thing is, I, for example, wear compression socks. These compression socks kind of have a graduated compression where it's tighter at the ankle and it sort of decreases in compression as you go up towards the knee.
So is it covered by insurance?
Yes. If this is medically necessary, most insurances will cover procedures. It's more cost effective, I guess, for an insurance to treat the disease while it's in its early stages and wait till they have ulcers and chronic problems.
And if you've noticed that maybe you're suffering from varicose veins, they can come in here, right?
That's right. If you are having symptoms, please come and see us. We'll do a free screening through the end of the year.
All right, for more information on Medical Vein Clinic, just call 622-8000, 622-8000, or head to medicalveinclinic.com.
After an